Two cases of monkeypox in South Africa, but against a global backdrop of infections in countries that have never experienced this virus. Our health authorities are urging us to be vigilant. Let's speak now to Professor Adrian Puren, Executive Director of the National Institute of Communicable Diseases. Professor, thank you so much for your time this evening. So, monkeypox is endemic to parts of Central and West Africa. Why would it, 20 years after it spread from animals to humans in those areas, suddenly appear in new countries? Professor Puren, can you hear me? Sorry, there we go.
Yes, I can hear you now. My apologies, yes.
No
so I think what has happened, in fact, that we have actually had cases that have been imported during this period. But this is the largest, I think, human-to-human outbreak outside of those endemic areas. So I think the importation has been by humans into those particular countries and then spread from person to person. So there have been other cases, because we know that monkeypox is primarily a zoonosis. And so we have had certainly cases of importation of animals to, for example, the United States, and that has spread to humans. But I think this is the first time, as I said, such a large and extraordinary number of cases have actually spread from human to humans outside of zoonotic spread.
So there are two clades or strains, one more deadly than the other.
Yes.
Can you confirm that the two cases in South Africa are of the non-deadly variant?
So thus far, we've managed to sequence the one, and we are in the process of completing the sequencing of the second case. And these have been uploaded onto the international websites for public viewing. And we can confirm that this is the clade that is now in circulation elsewhere in terms of Europe and elsewhere. So it fits quite closely to those particular sequences that have been that's in the public domain.
And do you know the case fatality ratio of monkeypox and how it compares to COVID and perhaps other viruses that we're seeing?
Yes, so I think we need to be cautious about the case fatality rate. In that, I think we've had the initial reports of, say, 1 to 10%, but that's primarily from the reports of Western and Central Africa, for example. In this particular outbreak that has started, let's say, from January up to this particular point, I think there's only been one reported death that I'm aware of, that is from Nigeria, but no other deaths. So I think the so-called case fatality rate thus far has really been not significant at all compared to what has been previously reported for these particular clades.
So we've been urged to be vigilant, but it doesn't spread through the air like COVID. And this strain is non-deadly,
Yeah.
So surely it's a huge overreaction to even be mentioning it.
Yes, I think we just need to be aware of what is happening with regard to a zoonosis, or previously a zoonosis that now spreads from human to humans. I think we need to be aware of that. People who have been traveling and have possible exposure should and do present with particular signs and symptoms that may be characteristic should seek attention. So the risk, you're quite right, for the general population, I think the WHO has said, is probably moderate to lower than that. Whereas perhaps in particular settings, well, in Europe at least, and other places, it may well be higher depending on which network or social network those individuals find themselves, yes.
Is there any likelihood of COVID-like regulations being brought back into play should monkeypox spread?
No, I don't think so. This is, as you indicated, this is a mild disease. I think what is really critical is really to do the appropriate contact tracing, both the forward and the back tracing, in order to identify cases so that they can be managed appropriately, and that we can provide the necessary information, lead on to appropriate isolation and management of those cases to prevent transmission further than what we have seen currently. So I do not think that there's a call or a need to call for such regulations. I think it's a call really for us to provide the necessary information so that people are aware of what this disease is about, and to manage it appropriately. And contact tracing is a key part to this, given that it is relatively mild compared to other diseases. And the spread, of course, is really not to the same extent as COVID. In fact, it's much less so. So the transmissibility rates are really going to be fairly low.
So for those who want to be vigilant and exercise caution, what kind of contact would spread monkeypox? We know that that's intimate contact, so surely incidental brushing past someone, if you're paying at a store and handed someone a credit card, would that kind of contact be enough to transmit the virus?
No, so again, you're quite right, and I think we need to emphasize this. This is a virus, as I said, that's relatively poorly transmissible, so you really need close and prolonged contact. In other words, really face-to-face contact for droplet spread, for example, kissing, cuddling, intimate contact, for example, that will lead to that exposure. It is certainly fomite transmissible as well. So, in other words, sharing of common spaces and utilization of, let's say, bed linen, clothes, and so forth, is some form of transmission can certainly occur. So you'll see that in families and in other settings where there's close and intimate contact, yes.
So we've just heard in the last week or two that we no longer have to wear masks in public. If you're talking about droplet-based spread, do you think it would be necessary or prudent for South Africans who are fearful to start wearing masks again?
I think not specifically for monkeypox necessarily. I think we need to gauge our risks regardless. I think, as you know, there are other circulating viruses other than monkeypox that are more transmissible, where mask wearing may be more appropriate given one's particular risks. So, for example, influenza and COVID-19 are the best examples of where you may want to, again, reconsider your risks rather than just simply looking at monkeypox specifically.
Excellent. Thank you so much for clarifying some of those issues. Professor Adrian Puren, NICD Executive Director, talking to us there about the 2 cases of monkeypox now in South Africa.